Let me ask you something personal. When was the last time you left a doctor's office feeling more confused and anxious than when you walked in? If you're nodding your head right now, you're not alone. And what I'm about to share with you today might make some of my fellow doctors uncomfortable, but after nearly 2 decades of watching this happen over and over again, I can't stay silent anymore. I'm Dr. Benjamin Walker, but you can call me Ben, and I need to tell you about something that's been bothering me throughout my entire medical career. Something that affects millions of Americans over 55, and yet nobody seems to want to talk about it honestly. Here it is. The medical system has convinced us that more testing equals better health. But what if that's not always true? What if sometimes, especially as we get older, those extra tests are actually making things worse? Now, I know what some of you are thinking. Wait, isn't this doctor supposed to be encouraging me to get every screening available? Isn't early detection the golden rule? And yes, that's what we've been taught. That's the message plastered on billboards, in TV commercials, and in every health magazine you pick up. Find it early. Test for everything. Stay ahead of disease. It sounds brilliant, doesn't it? But there's a side to this story that rarely gets told. The side about what actually happens after something shows up on a test. Because finding something is just the beginning. And sometimes, that beginning leads you down a path you never wanted to travel. So today, I'm going to walk you through 4 common medical tests that I've seen cause more harm than help, particularly for people in your age group. And I'm not doing this to make you afraid of healthcare. I'm doing this because I believe you deserve to know the full story before you agree to every test that gets recommended. You deserve to make informed choices about your own body. Before we dive into the specific tests, there's something critical you need to understand. Something that fundamentally changed how I approach medicine. It's called overdiagnosis cascade, and once you understand it, you'll start seeing it everywhere. Here's how it works in the real world. You walk into your doctor's office feeling perfectly healthy. You're active, you're enjoying life, everything feels normal. Your doctor suggests a screening test, just routine, just to be safe. You agree because why wouldn't you? Prevention is smart, right? The test comes back with a finding. Maybe it's described as an abnormality, or an area of concern, or something that needs monitoring. Now, that finding might be something that's been in your body for years. It might be something that will sit there for the rest of your life without ever causing a single symptom. But here's where the problem starts. Once it's been found, it can't be unfound. Your doctor sees it, documents it, and now there's a medical responsibility to follow up. Because what happens if they ignore it and it turns out to be serious? Nobody wants to take that risk. So you get referred to a specialist. The specialist looks at the same finding and recommends another test, something more detailed, more invasive. That second test shows the same thing, maybe a little clearer, but still unclear enough that now we're talking about a biopsy, or maybe an exploratory procedure. Each step sounds reasonable in isolation. Each doctor is just being thorough, just being careful, but nobody's looking at the big picture. Nobody's asking whether this entire journey was necessary in the first place. And with each step, there are real risks. Anesthesia complications, infections, bleeding, days or weeks of recovery, mountains of anxiety. And the cruel irony? At the end of this months-long journey, you often discover it was nothing. It was never going to hurt you. But now you've been through medical procedures, you've dealt with complications, you've lost time, and you're actually worse off than when you started. All because of one screening test when you felt completely fine. That's the cascade. And it starts with a single decision to get tested. Let me tell you about the first test that I see triggering this cascade constantly. And this one's particularly tricky because it sounds so advanced, so comprehensive. I'm talking about full-body imaging scans. You've probably seen the advertisements. CT scans or MRIs that check everything from your head down to your toes. They promise peace of mind. They promise to catch anything dangerous before it becomes a problem. The marketing is brilliant. Know what's inside. Take control of your health. Don't wait for symptoms. It sounds empowering, doesn't it? But let me tell you what actually happens when a healthy 65-year-old gets one of these scans. Let's say this person is you. You're feeling great. You're walking every morning. You're playing with your grandchildren. You have energy. No complaints. But you decide to get scanned, just to be proactive. You spend 30 minutes in the machine, and a few days later, the report arrives. And buried in the medical jargon, the radiologist mentions something. A small nodule in your lung, 4 millimeters wide, or maybe a lesion on your liver, or a cyst on your kidney. The report ends with those anxiety-inducing words. Recommend clinical correlation and follow-up imaging. How does that feel? You went in feeling healthy, in control. You came out being told there's something in your body that needs watching, something potentially dangerous. Suddenly, every breath feels different. Every sensation in your abdomen makes you wonder, is it growing? Is it cancer? You can't stop thinking about it. 3 months later, you're back in the scanner. The thing is still there. Maybe it looks slightly different, hard to tell. The radiologist suggests consulting with a specialist. The specialist wants to be cautious, so they recommend a biopsy. Now we're talking about a real procedure. Anesthesia, needles going into your lung or kidney or liver. Risk of puncturing something, risk of infection, days of discomfort afterward. And here's what the research actually shows. When you scan healthy people over the age of 55, you find something unusual in almost everyone. I'm not being dramatic here. We're talking about 85 to 95% of people having some kind of incidental finding. Little spots, little shadows, little irregularities. The medical world calls them incidentalomas, things we discovered by accident. And the overwhelming majority of these findings will never ever cause a health problem. They're just part of having lived in a body for 6 decades. They're normal variations. But the moment they're documented in a medical record, they can't be ignored. There's actually solid research backing this up. Scientists followed thousands of people who got these whole body scans and compared them to people who didn't. And you know what the data showed? The people who got scanned didn't live longer. They didn't avoid diseases, but they did have significantly higher rates of anxiety disorders, depression, and unnecessary medical procedures. The scans didn't improve their health, they damaged it. So what's the smarter approach? And this is crucial because I'm absolutely not suggesting you ignore your health. I'm suggesting you focus on what actually matters. Instead of taking pictures of your organs, pay attention to how your body functions in real life. Can you walk up a flight of stairs without getting winded? Can you stand up from sitting without using your arms? How's your balance when you're on uneven ground? How's your sleep quality? These functional tests tell us infinitely more about your actual health than any scan ever could. If you want a meaningful health assessment, find a doctor who will spend real time with you. Someone who will review every single medication you're taking, because I can almost guarantee at least one of them is causing more problems than it's solving. Someone who will talk about your nutrition, your physical activity, your social connections, your mental health. Because those everyday factors, the unsexy, boring stuff, that's what determines whether you're truly healthy. The scan is looking for theoretical problems. The functional assessment is optimizing the health you already have. Completely different approaches. Now let's talk about the second test. And this one touches on something that terrifies people as they age. I'm talking about getting brain scans for everyday memory lapses. Here's the typical story. Maybe you're 68 years old, and lately you've noticed that sometimes you forget where you put your car keys. Or you walk into the kitchen and can't remember what you went in there for. Or you can't recall the name of that restaurant you went to last month. Normal stuff, the kind of thing that happens to literally everyone as they get older. But maybe your adult children are worried. Maybe they've read articles about Alzheimer's disease and they're scared. So they insist you get a brain scan just to check, just to make sure everything's okay. And I completely understand that fear. The thought of losing your memory, losing your independence, losing yourself, it's terrifying. But here's what you need to know. Getting a brain MRI for mild, everyday forgetfulness is rarely helpful, and it's often genuinely harmful. Because here's what happens. You get the scan. A week later, you're sitting in the doctor's office, and they pull up the report on the computer screen. And the report uses terms like moderate cerebral atrophy, chronic small vessel ischemic changes, paraventricular white matter hyperintensities. These phrases sound absolutely terrifying. They sound like your brain is falling apart. They sound like you're on a fast track to dementia. But here's the reality. Those findings are completely normal for someone in their late 60s or 70s. They describe what every aging brain looks like. It's like scanning your hands and being shocked to find wrinkles and age spots. Of course, they're there. That's what hands look like at 70. The problem is the language. The medical terminology doesn't sound normal. It sounds like disease. It sounds like damage. And suddenly, you're walking around thinking you have a deteriorating brain, thinking Alzheimer's is inevitable. Even though functionally you're doing just fine. You're reading books, managing your finances, having conversations, living your life. But now you have this report that says your brain looks abnormal, and it changes everything. Here's what really frustrates me. Studies have shown that when you scan the brains of cognitively normal people over 70, more than 90% of them have findings that look concerning on the images. More than 90%. But most of those people have perfectly normal memory and thinking abilities. The pictures don't correlate with reality. I've treated patients who are mentally sharp, who are doing complex puzzles, who are managing businesses, and their brain scans look terrible according to the report. And I've treated patients with genuine early dementia whose brain scans look relatively normal. The image doesn't tell us what we think it tells us. So what should you actually do if you're concerned about your memory? There's a much better, simpler, more accurate way to assess this. We can do brief cognitive tests right in the office, 10-minute evaluations. We ask you to remember a list of words, we have you draw a simple clock, we ask you to do some basic math. Simple tasks that actually measure how your brain is functioning in real time, not just how it looks on film. And if those tests reveal a genuine problem, then we start investigating the causes. And here's the crucial part. Most causes of memory trouble in older adults are completely reversible. It could be a medication that's making you foggy. It could be low vitamin B12 levels. It could be depression, which often manifests as memory problems in people over 60. It could be untreated sleep apnea starving your brain of oxygen every night. It could be thyroid dysfunction. We check all of those things first systematically, and you'd be amazed how often correcting one of those issues completely resolves the memory complaints. No brain scan needed. We're evaluating function, not appearance. We're treating the person, not the picture. Now, if someone is experiencing progressive, worsening memory loss, if they're getting lost driving in familiar neighborhoods, if they can't manage their medications or finances anymore, that's different. That warrants a comprehensive evaluation, including imaging. But for the normal, mild forgetfulness that comes with aging, a brain MRI creates anxiety without providing useful information. Let's move to the third test. And this one surprises people because it seems so sensible, so obviously smart. I'm talking about cardiac stress tests, specifically putting people on treadmills just because they've reached a certain age. Here's a common scenario. You're 70 years old and you need some kind of routine surgery. Maybe it's a hip replacement. Maybe it's cataract surgery. And the hospital's protocol states that everyone over 65 needs a cardiac clearance before any procedure. So even though you feel completely fine, even though you can walk around your neighborhood every day without any chest pain or breathing problems, the hospital insists you get on a treadmill with electrodes attached to your chest. Think about this logically for a moment. If you're already walking significant distances in your daily life without any symptoms, what exactly is the treadmill going to reveal that we don't already know? Your daily life is your stress test. You're already passing it every single day. But protocol is protocol, so you show up for the test. And this is where things get problematic. Stress tests have an extremely high rate of false positive results in older adults. That means the test indicates a problem when there isn't actually a problem. It could be because your heart rate doesn't increase the way it used to. It could be because of medications affecting your heart rhythm. It could be dozens of technical reasons that have nothing to do with dangerous blockages in your arteries. But once that test result comes back as abnormal, you're on the medical assembly line. They schedule you for a cardiac catheterization. That's the procedure where they thread a thin tube through an artery in your groin or wrist all the way up to your heart to look directly at the blood vessels. It's invasive, it requires sedation, it carries real risks of bleeding, infection, stroke, even heart attack. And frequently they get in there and find exactly what you'd expect in a 70-year-old heart. Some plaque buildup, some mild narrowing, but nothing that requires stents. Nothing that was about to cause a heart attack. Nothing that needed this invasive procedure. But now you've been through it. And even worse, you've been labeled as a cardiac patient. They start you on multiple new medications. The psychological damage has been done. Maybe before this you were active. Maybe you were playing tennis or gardening or dancing. But now you're afraid to exert yourself. You're afraid your heart can't handle it. The test that was supposed to protect you has actually stolen your confidence and restricted your life. So what's the better alternative? Listen to what your body tells you every single day. That's the most accurate stress test available. If you can climb stairs, if you can walk at a brisk pace, if you can do your normal daily activities without chest discomfort or unusual shortness of breath, your heart is telling you it's doing okay. Those are the symptoms that matter. Chest pressure with physical activity, severe shortness of breath, dizziness, or fainting. If you experience those, absolutely get evaluated immediately. That's when a stress test makes perfect sense. But if you want to understand your actual risk for future heart problems, there's a far better tool. It's called a coronary calcium score. It's a quick, simple CT scan that takes about 5 minutes. No treadmill, no needles, very low radiation exposure. It measures the amount of calcium, essentially hardened cholesterol deposits, in your coronary arteries. you get a numerical score. A score of 0 means very low risk of heart attack in the next 5 to 10 years. A high score means you need to take prevention seriously with lifestyle changes and possibly medication. But here's the critical difference. The calcium score gives you information about your risk level. It helps guide prevention strategies. It doesn't automatically funnel you into invasive procedures. It empowers you to make informed decisions rather than triggering anxiety that forces you down a predetermined path. Don't let someone put you on a treadmill just because of your birthday. Trust what your body is already demonstrating to you every day. Now we reach the fourth test, and I know this one might be controversial. I'm talking about colonoscopies after age 75, specifically routine screening colonoscopies when your previous exams have been normal and you don't have special risk factors. And let me be absolutely clear here. I'm not against colonoscopies as a tool. They're incredibly valuable. I strongly recommend them starting at age 45. They prevent colon cancer by allowing us to find and remove polyps before they can turn into cancer. If you're in your 50s, 60s, or early 70s and you're due for one, please get it done. But here's what people don't always understand. Every medical test involves weighing benefits against risks, and that equation changes as we age. The benefit of a colonoscopy is preventing a cancer that typically takes 7 to 10 years to develop from a polyp into a life-threatening disease. But if you're 78 or 82 years old, does that benefit still outweigh the risks? Because colonoscopies absolutely do carry risks, and those risks increase significantly with age. There's the preparation process, drinking that horrible liquid that keeps you running to the bathroom all night, which can leave an older person severely dehydrated and weak. There's the sedation, which in older adults carries higher risks of confusion, breathing difficulties, and dangerous drops in blood pressure. And then there's the risk that worries us doctors the most: perforation, a tear in the wall of the colon. As we age, the colon wall becomes thinner and more fragile. The risk of the scope accidentally creating a tear roughly doubles or triples after age 75. And a perforation is a surgical emergency. It usually means emergency abdominal surgery. Sometimes it results in needing a colostomy bag. For an 80-year-old, that kind of major surgery can mean losing independence permanently. Now, balance that against the potential benefit. You're trying to prevent a cancer that would take 7 to 10 years to become dangerous. If your realistic life expectancy is less than 10 years based on your overall health, the mathematics doesn't support it. You're statistically more likely to be harmed by the colonoscopy than saved by it. That's why current medical guidelines recommend stopping routine screening somewhere between ages 75 and 85, depending on individual circumstances. Now, this isn't a rigid rule for everyone. If you have a strong family history of colon cancer, if you've had advanced polyps in the past, if you have inflammatory bowel disease, that changes the calculation entirely. But for the average person with no special risk factors, continuing routine colonoscopies every 5 or 10 years into your 80s is likely creating more risk than benefit. So what should you do instead? Do you just ignore your colon health? Absolutely not. You shift your strategy from invasive screening to intelligent monitoring. First, pay close attention to symptoms. This is absolutely crucial. If you notice persistent changes in your bowel patterns, if you see blood in your stool, if you have unexplained abdominal pain or unintended weight loss, if blood tests show you've developed anemia, those are serious warning signs. At that point, age becomes irrelevant. You need a colonoscopy immediately to determine what's causing those symptoms. Second, harness the incredible power of nutrition. This is huge, and it's something you can control completely. The single most important thing you can do for your colon health is eat adequate fiber every single day. Fruits, vegetables, beans, lentils, whole grains. Fiber feeds the beneficial bacteria living in your digestive system, and those bacteria produce compounds that directly protect against inflammation and cancer development. Eating more berries, more leafy greens, more oatmeal, more chickpeas, that's genuine prevention that benefits your entire body with zero risk and zero side effects. If you found this information valuable, please share this video with your loved ones who are facing similar health decisions. They deserve to hear this perspective too. So there you have it. 4 common tests that I regularly see causing more harm than benefit, especially for people over 55. full body scans that discover problems that aren't really problems, brain imaging for normal aging-related forgetfulness that creates abnormal levels of anxiety, routine cardiac stress tests that trigger cascades of unnecessary procedures, and screening colonoscopies after 75 that carry more risk than they prevent. You notice the common thread running through all of these? It's the cascade effect. One test leads to another test, which leads to a specialist, which leads to a procedure, which leads to complications. And somewhere in that cascade, we lose sight of the most important question. Is this person's life actually better because of all this medical intervention? Because here's what I've learned over 18 years of practicing medicine. True health isn't about achieving perfect numbers on test results. Health is about maintaining function. It's about being able to do the activities that bring you joy. It's about spending time with people you love, taking walks in nature, pursuing hobbies, living your life with confidence rather than fear, and without unnecessary medical interference that diminishes your quality of life. The goal at 65 or 72 or 80 isn't simply to extend your lifespan by any means necessary. The goal is to protect your quality of life, your independence, your dignity, your sense of purpose and joy. And sometimes the most effective way to protect all of that is to thoughtfully decline a test that's going to send you down a rabbit hole you don't need to explore. Now, I want to be crystal clear. I'm not telling you to avoid medical care entirely. I'm encouraging you to be an informed, empowered patient. Ask questions, lots of questions. When any doctor recommends a test, ask them why it's being recommended for you specifically. Ask what happens if the test finds something abnormal. Ask about the risks of the test itself. Ask if there are alternative approaches. Ask what happens if you choose not to do the test, and then make your decision based on your own values, your own priorities, what matters most to you in your life. You are ultimately in charge of your own healthcare, not the standardized protocols, not the computer-generated reminders, not the one-size-fits-all guidelines. You, and the more you understand about what you're consenting to, the better equipped you are to make decisions that truly serve your well-being. If this conversation resonated with you, if it gave you a new framework for thinking about medical testing, I'd be grateful if you'd subscribe to this channel. I'm committed to having these honest, sometimes uncomfortable conversations because I believe they genuinely matter. They can change lives. Let me know in the comments section. Have you ever felt pressured into getting a medical test that didn't feel right to you? What was that experience like? I read every single comment, and I learned from your stories just as much as I hope you learned from mine. Thank you for watching today. Take excellent care of yourselves. And remember, sometimes the wisest, healthiest choice you can make is to trust your body and choose less medical intervention rather than more.